Inflammation. Pathophysiology of inflammation. So it starts as a localized protective response, which is often stimulated by injury to the tissues. So what happens is it causes arterial, venous, and capillary dilation in order to enhance the blood flow and vascular permeability. Signs and symptoms of inflammation include pain, fever, loss of function, redness, and swelling. Exudation of fluids or oozing of fluid through pores or a wound, including plasma proteins, can also happen, and leukocyte migration as well. In this process, some inflammatory mediators, such as histamine, serotonin, bradykinin, and leukotrienes, and prostaglandins play a key role to inflammation. There are different conditions or diseases that cause inflammation, but for this class, we're just going to talk about certain ones. First, let's talk about injury. So, after an injury, it is normal to have inflammation or activate the inflammatory process. So, after an injury, the inflammatory response occurs in the localized area. So, when it happens, you may notice that there's increased fluid or swelling, and sometimes, although it is a defense mechanism, it can also cause pain and possible alteration in function due to the pressure. Another condition that we're going to talk about is gout. So what's gout? The cause of gout is from uric acid crystal buildup in the joints. Uric acid is the end product of purine metabolism. So purines are part of our normal dietary intake. They're used by DNA and RNA production. Now, where does this purine come from? So it is broken down in the liver, and there are certain foods that are high in purine. Examples of those are alcohol, fish or seafood, bacon, turkey, veal, organ meats like liver. Uric acid is excreted by the kidneys, so it does affect the renal function. There are non-pharmacological treatment, including avoiding food that are high in purines, as well as resting and elevation of the area that's affected. However, sometimes when those methods don't work, we resort to pharmacological treatments. These are some pharmacological treatment for gout, and the ones that you have to remember are the ones with an asterisk. And so these are the prototypes. So first, we have Colchicine or colchicine. Colchicine is the oldest available therapy for acute gout, and it decreases the inflammatory response to deposits of uric crystals, and it's second-line therapy after NSAIDs. Next, we have Zyloprim or allopurinol. This medication helps prevent uric acid production, and we have to monitor for therapeutic response. So this is mainly to decrease uric acid levels, and this is often used as a maintenance medication rather than as a medication as needed with gout attacks. The next disease process that we're going to talk about is rheumatoid arthritis. Rheumatoid arthritis is diagnosed normally based on symptoms, so patients often come to their doctor's office with complaints of bilateral pain in the joints or the small joints, so often including the hands and the feet. As you can see, it's often bilateral. It doesn't mean that it doesn't happen unilaterally, but often the presentation is bilateral. So this is an autoimmune process or autoimmune disease. So what happens is the body starts attacking its own joints. It does cause some inflammation, joint dysfunction, and pain, and this can worsen over time if it's not treated. There are non-pharmacological treatment for rheumatoid arthritis. Often, patients are instructed to rest, splint, and sometimes they end up with joint replacement when the joint is no longer functional or when the patient's abilities become limited. Now, the pharmacological treatment include NSAIDs, opioids, disease-modifying drugs, and some specific drugs and combinations that are depending on the patient condition. Now, especially the disease-modifying drugs, they have quite an array of side effects and adverse effects. Therefore, a lot of the providers are very careful when it comes to prescribing those medications. So, you may see some patients with rheumatoid arthritis without any medications at all. And sometimes you may see some patients on rheumatoid arthritis medications and they're considered immunocompromised because that actually oftentimes those medications limit or prevent the immune system from attacking its own self. Unfortunately, the effect to that is actually weakening the immune system against other diseases or infections. Another inflammatory condition is osteoarthritis. So in this case, the complaint is often unilateral and In contrast to rheumatoid arthritis, which is considered an autoimmune or the body attacks itself, osteoarthritis is actually from wear and tear, oftentimes from repetitive activities that tears down the joints. So it causes bone and joint degeneration, and usually it is age related. So there's a higher risk the older we get. So the problem here is often pain, decreased range of motion because of the pain, and sometimes because of the calcifications in the joints, and also limited function. There are non-pharmacological treatment, which again include resting, minimizing trauma, and sometimes joint replacement, as well as ice compress and all those things. Now, pharmacological treatment include non-opioid drugs such as Tylenol or acetaminophen, especially for pain, and then we also have NSAIDs or non-steroidal anti-inflammatory drugs. Now we're going to talk about fever. So what's fever? The definition of fever is basically a body temperature that's above normal. What's normal will depend on patient's age and also depending on the reference that you're going to be using. So fever is also a defense mechanism. It mostly happens during viral or bacterial infection. And so by raising the temperature, it's our body's ways of fighting viruses and bacteria. Unfortunately, even though it's considered as a defense mechanism, prolonged or very high fever can cause negative consequences on the body, right? So prolonged fever can cause seizures. It can cause diminished cellular function. It can cause delirium and coma. It increases the body's demand and it increases the workload of the cells. The temperature set point. During an illness, shivering can occur. Oftentimes, this is secondary to the body's thermostat or temperature set point being adjusted. What happens is here, the skeletal muscles shake in small movements, often small, fast movements, to create warmth. And just like fever, this can be normal or expected response when somebody is ill. That being said, this can cause some negative effects on the body as it increases the oxygen demand, and it's costly to the body, especially when it's happening for a prolonged period of time. There are non-pharmacological treatments, so one, definitely treat the cause. So if we know that the cause of the fever is from an infection, it is very important to treat the underlying disease or infection. And also, another treatment would include cooling measures. So making sure that we're limiting the blankets. Sometimes we can use some ice packs. That being said, we need to take in consideration shivering, because that can actually cause the opposite effect, because then when we start cooling down the body can get overwhelmed, and sometimes as an expected response, the body starts shivering because of the cold. And so with that shivering, it can even increase the temperature even more than what we had to begin with. So we have to be very careful. Cooling measures should be started accordingly and while monitoring the patient, while preventing shivering or intense shivering, especially for a prolonged period of time. Now, there are pharmacological treatments for that. So sometimes we can use Tylenol or acetaminophen, right, for antipyretic. Sometimes we can also use Motrin or ibuprofen, which is also an NSAID. And also we can use aspirin, which is also an NSAID. What we have to remember, though, is that when it comes to children, especially if we know or there's a possibility of a disease being viral in nature, we need to avoid aspirin. Why is that? Remember from what we discussed previously, because of their possibility of developing Reye syndrome, which can be detrimental to their brain and liver. So remember that aspirin is contraindicated in children, as well as diagnosis of chickenpox due to Reye syndrome.